Hi, welcome to our presentation. I hope you are enjoying your conference so far. Sean and I are presenting COVID-19 and mental wellness for the homelessness service and supportive housing workforce. And my name is Katerina, and I am a policy analyst at the Mental Health Commission of Canada.
I'm Sean Kidd. I'm a clinical psychologist and scientist with the Center for Addiction and Mental Health in Toronto and faculty with the University of Toronto Department of Psychiatry.
So we'll start with a land acknowledgement.
Sure, yeah, so I can go first. So the land I'm broadcasting on is quite close to CAMH's Queen Street West campus. And this land is on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. And I think it's also important to note that the topic that we're speaking about today is very reflective of the intergenerational trauma and the cultural genocide that's happened in Canada and the disproportionately large numbers of Inuit, First Nations, and Métis peoples that we find on the streets in our country or inadequately housed, and also the many organizations and people from the First Nations, Inuit and Métis groups who are working with the folks living in street and homeless environments and situations. So I think this topic is very germane to these cultures and the hard work and road ahead as we look to enact reconciliation. And perhaps this presentation is one part of the truth that many people in Canada are living who are Indigenous.
Yeah, and I'll share that the Mental Health Commission of Canada is on the unceded traditional territory of the Anishinaabe Algonquin Nation, whose presence in Ottawa reaches back to time immemorial. The Algonquin people have lived on this land as keepers and defenders of the Ottawa River watershed and its tributaries. We are privileged to benefit from their long history of welcoming many nations to this beautiful territory. Feel free to leave in the chat where you're coming from today as well. So this is the agenda.
Yeah, so we're going to walk through a few things here. This is essentially us describing one quite substantial research study. And we're going to walk through some background as to the why part of why it was done, talk about some of the key results, recognizing this data is still being analyzed and there is more to come, but this is sort of a bit of a sneak preview of where it's at in current state. And we're going to speak to the conclusions and implications from these data in terms of practice and policy, and do some acknowledgements at the end. But I think there's a really important few acknowledgements to do at the beginning. First off, is that it's important to acknowledge that this work has really been done primarily by Dr. Nick Kerman, who's a psychologist and postdoctoral fellow at the Center for Addiction and Mental Health in Toronto. He is on leave as a new parent during the conference and the lead up to the conference, so unfortunately couldn't attend, but it is really important to acknowledge that this is really his hard work that is the backbone of this effort and how it came together with the commission. And really it's all about trying to take these data and put them into action to make a difference for service providers across the country working with populations experiencing homelessness. And of course, that'll make a difference with the populations themselves. Secondly, it'd be good to acknowledge the funders of this work. So Nick was funded by a postdoctoral fellowship from the Canadian Institutes for Health Research, and he also received support from the Discovery Fund within the CAMH Foundation. So that support was instrumental in getting this work started and bringing it to where it is today. And that's what we're excited to share with you.
Yeah, okay. So we'll move into the rationale.
All right, so so what we're going to do is we're going to do our best here with this virtual format, and we might do a little bit of back and forth on some of the slides. So in terms of background, let's cover a few key bits, and Katerina, feel free to jump in. But just basically, there's something in healthcare called the quadruple aim, which is an important concept, I think, to think about, even though in this context, we might not necessarily be thinking about patients or people referred to as patients. But the quadruple aim really speaks to like what comes together to make for or create a situation in which people have optimal care and the best possible outcomes. And there are a few things. One is improving the provider experience, excuse me, and that's fundamentally what this research is about, is trying to understand, what are the challenges, where are the opportunities to optimize the experience of those working in the field. And as the first point speaks to, if we have providers, and these could be people working in a small community agency or some of the largest hospitals in the country, but if we have providers that don't feel secure in their work, are overly stressed, don't feel properly supported in all areas, ultimately the work done in those environments isn't going to be optimal, and that's going to lead to non-optimal outcomes, because we need everybody to be fully engaged and fully supported and at their best in order to provide the highest possible quality of care and see those good outcomes. And when we have the better outcomes experienced by people, we also, tied in with that, is want to be looking at improving the experience of people going through services. And tied in with all of this, of course, too, is recognizing, we kind of look at how mental health and addictions funding happens at a systems level across the country. Unfortunately, the funding is not nearly adequate as compared against the burden of illness nationally, as we're just fundamentally not funded adequately to provide all of the evidence-based services that we would like to and need to. So we're constantly in the service sector looking at the bottom line and the funding we have to provide services. And that is a part of this negotiation here as well. And as you might imagine, significant compromises or challenges in any one of these areas will impact all of the others. And that's fundamentally the model. Now, getting more specifically into service provision for populations experiencing homelessness. As I mentioned, people working in the space, like any other providers, are going to be providing better services and higher quality care when they are doing the best as they possibly can themselves. There's not a ton of data in this area, and this is really getting to why the study was done. On the quantitative side, there's a couple of studies showing that some fairly striking findings. For example, 33% of emergency shelter workers in Alberta screened positive for PTSD or post-traumatic stress symptoms. 24% had elevated levels of burnout and vicarious traumatization. Vicarious traumatization, of course, refers to situations in which people are working with populations or in situations where other people are badly traumatized, and some of that trauma carries over to the people trying to support them. And this is extremely important consideration because homelessness is fundamentally traumatizing. The amounts of violence and deprivation and trauma experiencing is pretty much almost universal for individuals who have experienced homelessness. And the trauma has come in many different forms, and they're constant. So that carries over to the people that are working with them day in and day out. And I think this finding is really a prompt and a concerning prompt, just showing that the folks working in the space are struggling with their own mental health as they're trying to support some folks in our country who are severely traumatized and really experiencing severe challenges. Next is, and I've touched on this already, is working in the sector is stressful and demanding with high levels of turnover. Many in the audience, I know that many people who are attending this conference and coming to this talk work in the space. I mean, people can probably relate to my experience. I don't know about you all, but I've certainly experienced it where, I'll know many people working in a given service. I go away for a little while, come back a year and a half, 2 years later, and it's almost a total turnover. Maybe a few of the more senior folks are still there, but it's almost all new faces. And I work in the homeless youth space specifically quite a bit. And this is a real challenge. And it's a challenge on a bunch of levels. It's a challenge as to what it indicates is, and we're going to get into this, is what are the issues that lead to high turnover in terms of the staff experience. But you can imagine what this does within services themselves is the turnover, the constant hiring and training and trying to get people in a place to do their best possible work. And then those folks end up leaving because of the many challenges related to doing that work. And then you're kind of back to the start again. And the folks who are engaging these services, relationships with providers drive a lot of outcome in any service in healthcare. And if the providers are routinely turning over, you're just getting to know somebody and getting to work with them well, and then they're gone. That creates challenges in terms of outcomes and quality of service. So a lot's happening there, and this is very, very common. But beyond, there's a few qualitative studies as well, but beyond this is really an understanding of these sorts of mental health challenges in the workforce in the homelessness space in Canada really wasn't systematically examined before Nick's study here. And I should say, just before we start to dive into some more specifics, this whole study was conceived pre-pandemic. The proposal went in, and the idea was to look at what's happening in the space and the service space across the country without considering the pandemic. The pandemic hit, of course, and it became part of the narrative here. So this is a discussion that is about two things really: is what's going on in general, the many challenges that were there before the pandemic, during it, and will be there long after it. But also we need to acknowledge just the fundamental impacts of dealing with COVID-19 across the country has had on the mental health of our providers in the space. Okay, so I don't know, Katerina, that's me talking a long time on that slide. Anything you wanted to add in?
No, that's great.
Okay, cool.
Yeah. We're just moving on to the background on studying and the methods.
Yeah, so I think I've covered what the intent was. There were two parts to this. We're really able to speak primarily to part one. And this was an online survey to direct service providers who are getting information on their mental health and well-being, including aspects of the COVID-19 pandemic. Now, I think a thing I have to acknowledge, and this is on behalf of Nick really, is Nick certainly worked hard to reach out to many, many organizations across the country. But I think both Nick and I were and Katerina as well, were fundamentally struck by the generosity with time of the many providers. Like this, we were reaching out at a really incredibly challenging time to organizations, and for the staff to take time out of severely challenged work environments to do this survey really speaks to their commitment towards the topic, wanting to give feedback and wanting action from this. I know from working in this space for many years, people won't do surveys if they think that it's just for the only purpose is for academics to publish papers and that sort of thing. This is about action. And I think this is the whole point of this talk, the whole point of this research, and the reason why these many hundreds of individuals, exhausted individuals, did this survey is because they want action. And that's kind of what we're about here today in part. And the second part of this is something that's kind of in the works. Is kind of a preview of coming attractions. So there's 40 qualitative interviews that Nick is just analyzing the data from now with direct service providers and people in leadership roles.
Yeah. Okay, so I think next up is to discuss the results.
All right, so here's a breakdown of responses across the country. Now, the good news is, as I mentioned, a huge number of responses. This is, and I wish Nick was here to correct me, I think roughly 300 or so more people than he expected when he wrote the proposal. I think when he wrote the proposal and put 400 respondents in, I was like, oh, I don't know, Nick. People might not think you'll get 400 responses. but here he is in the pandemic, getting 701 responses to the survey, and just speaks to the point I made a moment ago. The survey took about 30 minutes to complete, but it's important to acknowledge some representation limitations. So unlike what an epidemiological kind of study might do, where you're sampling in a representative way across a sector or a population, this is sort of more opportunistic, you could say, is basically reaching out and hoping and seeing who will respond. And so whenever you do research like that, there's going to be a few biases that come into it. These will be people that are motivated and interested in responding, people that have time, aren't out on leaves for health reasons, or aren't overwhelmed to an extent that they can't or won't respond. And so, I mean, I'll leave it to the audience to draw perhaps some conclusions about implications for the data. And then geographic representation, like obviously the coverage in the North and the territories was not where it doesn't cover what the number of people working in the space. And we've got an overrepresentation of Ontario, BC's looking okay, but then it gets pretty thin in other parts of the country. So these are considerations that are worth taking. But nonetheless, despite some of these limitations, this is the largest and the most representative study of this kind that we're aware of, certainly for Canada and quite possibly internationally as well. So let's consider this a good start, but certainly there will be parts of the picture that won't have been covered.
Yeah.
Okay, so we're going to dive into some of the major findings, and recognizing that not all of this is not all of the work is done. This is sort of, we could consider this a high level coverage of some of the key points. And as I mentioned, this looked at mental health and well-being generally, but it also referenced an index to the COVID-19 pandemic. So basically, this is a big number. It's about 80%. So 4 out of 5 service providers reported that their mental health and well-being declined during the pandemic. About 2/3 considered this a slight decline, whereas about 1/3 considered it really a substantial decline. And this is not that out of step with what we see in the healthcare sector generally. Of course, probably everyone in the audience will be aware of the burden on healthcare providers broadly, but generally it was about 70% across Canada in the healthcare sector did also report worsening of mental health due to the pandemic. So a little bit higher than that. So there are a few stories here, and I should say that looking at mental health and well-being generally, there were a few trends in there. One thing that can be said is that more or less, this is a common thread. It wasn't like there were large, differences as a function of where people were reporting from or, as a group, but there were a few trends. So younger people tended to be experiencing more mental health and well-being challenges in the survey, and people doing more direct service work tended to report more challenges. And that's not, certainly the more direct service work is not too surprising, but it's perhaps worth considering that younger staff members tended to be struggling to a greater extent. And that's, I think, speaks to the turnover issue I talked about earlier, where we do see quite a cycle of turnover in younger staff in these organizations. And as well, it should be noted that the majority of people working, or the majority of people who completed the survey were women working in this space. So one of the key findings that did come out of this, though, is related to what's happening during the pandemic. And this, I think, speaks as much to findings around substance use. So as people responding to the survey indicating about 1/3 increase their alcohol use during the pandemic, a little bit less than that cannabis, and then less so other substances, is this tells a story about people experiencing stress and challenge. But I think as important as I think through on what this means in terms of how people are coping, it's important, I think, to consider this as an indicator of what resources people are provided with to do this work, that that this is a major coping mechanism people are going towards. And this is kind of going to get into what we're going to be speaking about shortly, about the need for better support of people working in the sector.
Yeah.
And just over 40% had a positive screen for what would be considered post-traumatic stress. So this speaks also to, looking at this national lens, it validates what was seen in the Alberta study that I mentioned earlier, that it is really very common for people to be experiencing post-traumatic stress. And so these are reactions to a traumatizing and deeply distressing experiences, usually in the course of doing the work. And kind of getting into some of the challenge areas here, so we kind of can make out the scale. So the purple means sort of low or mild challenges, and then it's the other colors, moderate, severe, and extremely severe are the ones to sort of watch, and the ones that are concerning. And that is where we see the sort of general stress is quite common, and there's like 12.1% of participants experience severe general stress. And if you break it out a little bit further, you can see quite high rates of anxiety and depression, with over 70% in the moderate to extremely severe range. And if you look at anxiety, 13.1% are in the extremely severe range. So, I mean, I think this graph tells us a few things. First off, there is a story here of resilience. I think this is an audience of many service providers, people with lived experience, and others. But knowing how hard this work is, and that about 2/3 are coping quite well. I think that's important to acknowledge, despite the many challenges, and are resilient. Highly resilient despite the many challenges, is that the work is challenging to an extent that that there is a really substantial proportion of people who are struggling, who are also quite resilient, but the struggles that they're facing are such that it has become overwhelming, and they are experiencing a large amount of distress. And looking at this is sort of a busy slide, but looking at the kinds of challenges, and I won't go through them all, that are driving, and this is, I think it's important to note, is the chronic stressors. So this is what this survey was getting at, is less sort of something that happens once in a long while or a one-off kind of a thing, but sort of looking at the things that are happening kind of day in and day out on the job as a stressor. And we're kind of, you can imagine we're sort of digging through the data here, going from very high level findings into some of the things that are driving those findings. Is what are the exposures? What are the daily experiences that are challenging people? And if you look at a few things here, for example, verbal abuse, so being subject to being told things that are verbally abusive. You look at 26.5%, 20%, 8%. Those are monthly, weekly, and daily experiences of people. Constant screaming, physical resistance of support, biohazards, damage to property, verbal abuse in the form of racism, self-injury, public sexual behavior, hoarding. You kind of can see all of these challenges. These really speak to the stress faced by this workforce. And as well, I think it also indirectly speaks to and helps elucidate just the profound challenges being experienced by populations who are going through the experience of homelessness and inadequate housing, the distress, the mental health challenges, and just the fundamental deprivations happening there. And I think hopefully this is, for the audience, starting to paint a portrait of, why you have a group of very committed people, very strong and resilient people who are trying to do this work, who are really highly distressed and experiencing that distress in an ongoing way. And we're going to head into shortly the kinds of supports needed to consider this in terms of some of the lack of supports, but also in terms of what's needed to make a difference in the space.
Mm-hmm.
Okay, so I'm going to go through, just going to do a quick time check. I go through some early sort of main themes on the qualitative side. And I won't necessarily touch on each and every one, but it's sort of try and just cover some of the highlights here. So this is in relation to what contributes to mental health and wellness. And so by contributes, it doesn't mean necessarily all positive or all negative. It's sort of a bit of a mixed bag here, and I'll try and break those out a little bit. So what makes a difference at an individual level in terms of sustaining well-being, despite all those many challenges that I just described? So some of the things touched on there were boundary setting generally. So, and this certainly plays out into that work-life balance of understanding and being able to set some boundaries around personal needs as it relates to the needs of service users. And those needs are profound. Hopefully that's a running theme that I'm able to convey here. Acknowledging small wins. And this is something I've certainly seen quite a lot in the youth space, youth service space, is this is a very, like the folks that are coming to these many service settings, and whether this was a harm reduction service, supported housing, drop-in shelters, these are paths of a tremendous adversity, trauma, and marginalization, discrimination of many, many years for the vast majority of folks. So if these aren't settings and situations where one can readily go in and in a short period of time, let's call short a year, be able to really turn things hugely around for an individual, given all of the past challenges and all of the current points of adversity. So in a space like that, you really need to be able to acknowledge the small wins, the small changes. In my experience, it can be a person has clean socks. Is something to celebrate, so that their feet are more healthy, they feel a little bit better, and they've got clean socks. And it sounds like a tiny thing. You imagine that you'd be hoping the person is no longer suicidal or has stable housing or is getting a job. All of those big ticket items that certainly everyone's striving towards. But really being able to acknowledge that those small pieces is essential to mental health and well-being. Because in any job, in any of our jobs, we have to feel like we're making some kind of an impact and believe that we are and see it. And so that's essential in this space. Access to supports, social supports, we'll get into in some of the upcoming recommendations, talk about that. Self-care, routine and regular self-care, that's pretty common across most fields. And then sort of contributing to challenges is substance use to cope with vicarious trauma. So primarily alcohol and cannabis were commented on. And certainly this is something that that doesn't need a lot of emphasis, because we all know that there's a range of ways of coping with direct trauma and vicarious trauma and mental health challenges. And generally, go with a lot of evidence showing that if we go to alcohol and cannabis as primary or major coping mechanisms, it's just going to lead to something circular where a person experiences more and more challenge. And that's where really the nuance and the very hard work of trying to see what other supports need to be bolstered in, so that people are feeling like that's what needs resorting to, and that's what needs to be relied upon. Because while it might provide some short-term relief, in the long haul, it really causes challenges to people's health. At an organizational level, so there's some cultural issues in the space that were spoken about. The kind of sink or swim attitude for new staff. I mentioned the younger people struggling more, that turnover piece that's been observed. But there's something happening with young people in the space that needs to change, that we need to look at. It's less kind of, let's see how they do and, throw them in the deep end kind of mentality. I think that can cause some serious challenges for turnovers and mental health and well-being. This, as a sector, it's really, really unfortunate that the majority of people are working for wages that don't reflect the extent of the work they're doing, the difficulty of it, and the importance of it, and benefits as well. So it's wages and benefits both. This is a challenging space, and really people are often not experiencing, whether it's financial remuneration or other benefits, experiencing those or getting those benefits to the extent that they should. And this is a big problem, of course, across the board in terms of people keeping in careers in this space, continuity, but also well-being. Challenges related to shift work. This is not a 9-to-5 space. And people are often working long hours, late hours, overnight hours. Things like, and all of these things, of course, interact, but team cohesion, under recognition. And under recognition, let's speak about one issue related to this. It might not be under recognition in all instances of, from the service user perspective, from a manager perspective, those kinds of things. But if we look at what happened during the pandemic and the recognition provided, and please understand, as working in a hospital, it was well-placed recognition of, for example, nursing staff providing direct care in the media, and in terms of some extra, in some jurisdictions, some extra financial recognition. But really, the majority of people working working with the most marginalized in communities, often in the most exposed environments, with the least amount of organizational support, really weren't a part of that conversation about whether it was some extra funding, recognition in the media, as compared to others. And this isn't to put down the recognition of direct providers in places like hospitals, but it's really just to note, you can imagine what the experience was to see this happening in the media and financially when you are going into, for example, shelter environments, other environments where you're highly, highly exposed. The availability of supervision, event debriefing, we'll get into that a bit in the recommendations. I think a key piece is just general support, as many felt that they did not have access to psychotherapy and mental health and well-being supports that were needed to help people do probably a couple of things. One is to support those in distress, and that's substantial. It's about a third of folks indicated being in quite a bit of distress. And certainly many challenges emerging during the pandemic, but also to help support resilience, right? Because it's hard work, and even if a person feels like they're doing relatively well, people can often need support to not decline and to stay in the space. And another thing that came up was the benefits of leadership, service leadership, having had past direct service experience and being able to engage staff in a way that they understand the work. And, for example, shadowing frontline work. And I think this really is something that is across the service sector, is just the imperative that people in leadership positions really do need to fundamentally understand what direct service is about. And if they haven't done that work themselves, you need to do some shadowing and really get in there and understand the challenges people experience, be able to empathize and be able to make decisions to support their staff based on direct experience. And this applies to, I think, as well to folks who may have worked many, many years ago in direct service roles, but to keep a hand in and understand what's going on in the direct service space. Lastly, on the qualitative side, on the systems level, a lack of integration. I think at this conference, going to be lots of discussions at a systems level about really, we've got this as a sector is highly, highly fragmented, with largely lacking organized mechanisms for funding, organized mechanisms for collecting data and managing health data and other data surrounding the individuals going through the service, models of care, evidence-based care, knowledge promotion and mobilization, all these pieces. Lack of affordable housing, and the ongoing, I think, many people in this space will say the pandemic is nothing compared to the overdose crisis, the overdose pandemic that's happening in the country. As so many people dying, and that feeds right directly back to grief, vicarious traumatization, direct traumatization that's happening in the space of the many people who are working with folks who are routinely overdosing and dying. And we're seeing with the hotel placement model, which had some real benefits of getting people out of street and inadequate shelter environments. We often saw people dying in those more isolated spaces. I mean, it's a lot. I'm sure at this conference, a lot going on about that, but certainly providers felt that. Challenges getting access to mental health supports. And then the last one, this is a good one to end on, is discrimination, stigmatization of homelessness broadly affects everyone in this space. Obviously, it affects to the greatest extent individuals experiencing homelessness. Looking at intersectional discrimination, you've got individuals who might be two-spirit, gender, sexual minority folks, individuals from Indigenous communities also experiencing homelessness, also maybe have addictions. There are layers and layers that go into what creates stigma and discrimination for individuals. And as those things stack up, systemic barriers and points of opposition, and at times violence stacks up against the individuals experiencing this. And if you're in there with your sleeves rolled up trying to work in this space, looking at issues like recognition and engagement, you're in the midst of the stigmatization process as well. All right, I'll stop there in this slide. Sorry for taking a long time with it.
No, that's perfect. Yeah, so
I'll let you take this one.
Yeah, so I think definitely, so part of the research was this qualitative aspect that really excited me when I saw these quotes, because you get the real perspective from service providers, and these really kind of struck me and made me excited about this policy brief we worked on together. And so, yeah, so you can kind of see them here. I won't repeat them, but just the realness that comes through definitely struck me. Yeah, and so I'll just talk about the conclusions and implications, because at the Mental Health Commission, I worked with Sean and Nick to create a policy brief kind of based off the findings of their research, and part of our COVID-19 policy work at the Commission that is now available on our website, and I'll have the link in one of the other slides. But I just wanted to, first of all, give an overview of the Commission and kind of our work to date on this. So it really, the policy brief we worked on really builds off of 2 Mental Health Commission of Canada reports, Turning the Key, Assessing Housing and Related Supports for Persons Living with Mental Health Problems and Illness, and the National Final Report for the At-Home Shift Swap Project, which really provide a message that housing is a human right, homelessness is preventable, housing first is a cost-effective approach that is proven to work, and wraparound services are essential for preventing homelessness among people struggling with their mental health. And then as the COVID-19 pandemic began, we started working on a preliminary scan of the impacts, policy responses, and emerging issues the pandemic has on mental health, the pandemic was having on mental health. That work led to the development of the Commission's COVID-19 Resource Hub and several kind of projects that look at the cross-cutting effects of the pandemic, equity considerations with several organizations. We've been providing polling analysis, several policy briefs, and coordinating a sector roundtable that are all accessible within the Resource Hub. And this policy brief is part of that work. And so, yeah, so after hearing some of Nick and Sean's preliminary findings, we decided to work on it on a policy brief together to really bring to the forefront the impacts and policy considerations of COVID-19 for people providing services to individuals who experience homelessness or precarious housing. We really focused as well on the close links between mental health, substance use, and housing policy throughout the pandemic, success across various sets of systems, housing, mental health, and substance use was kind of important to us, and as we are all living and being supported by the same sets of systems. There's as well an important point here is like the equity considerations at this intersection. And here on the bottom of the slide is the link to the policy brief. Some of the policy considerations we explored are the impact the pandemic is having on mental health of the homelessness service support workforce, the struggles that this workforce is already struggling with in terms of the various systemic crises that Sean mentioned earlier, and you can see it kind of on the right here on this picture diagram. As well, another consideration we explored was kind of the social determinants of health that are felt more acutely, including, as Sean mentioned, being female-led, racialized often, and under-recognized, and again, young and new service providers being particularly at risk. And just how much COVID-19 has exacerbated all of these challenges as it introduced fears relating to the virus, increased stress, and isolation. Sean, is there something you would like to add?
Yeah, no, I think you covered it really well. I think this diagram shows it well, that this is not a pandemic crisis or a pandemic situation, though that certainly did make it worse. It made a situation that's already very fraught and challenged worse, and heightened and brought to the surface these challenges, and to an extent greater than before. But I do think this covers it very well.
Okay. Yeah, so I'll just move on to the recommendations that we put together, and these really are targeted to various levels of government, not just one. We kind of took a whole of government approach that homelessness during the pandemic and post-pandemic period should be prioritized by all levels of government, as well as prioritization of the service providers for resources as the pandemic continues. In the beginning, we were focused on vaccine supply, but now as we move into the post-pandemic period, mental health supports, other resources will also be increasingly important. Thirdly, extending improvements made during the pandemic to pay and benefits, including hazard pay and sick leave, as part of broader efforts to change the culture of invisibility. And just like we advocate for in terms of all health providers and service support workers across mental health, substance use, and the homelessness sector as well. Next is increasing workers' access to mental health and substance use services and supports, including through employment-based benefits or otherwise during and following the pandemic. I think this is one of the key ones for sure. As well as building capacity for the homelessness workforce to respond to the mental wellness needs of self and others through ongoing training and supervision. And finally, just strengthening support networks within and across organizations working to address homelessness, including through community support, support from managers, and peer support from coworkers and people with lived or living experience. Yeah.
I'll just jump in for a second, just with a quick comment, recognizing we're getting close to our time here. So this conference, there will be many conversations about strengthening supports to this workforce, or these workforces might be the better way of putting it. I do think, as much as this is a story of challenge and struggle and a very tired sector with a lot of distress, we also have some opportunities here. And perhaps the pandemic has lent itself to some opportunities, not to say that it's guaranteed, but it's opened our eyes perhaps as a country to a few things. First off, we have had a federal government that has been making some unprecedented investments into housing for people who are at risk of homelessness and experiencing homelessness. I think that's the start. I do think it would be really important to continue that momentum and consider in a thoughtful way engaging individuals with lived experience, overrepresented communities such as Indigenous populations, engaging the service leadership in the space, as well as direct service workers, to strategize on how to keep that momentum up and really recognize that housing, access to housing and housing infrastructure is essential, perhaps obviously, but we also need to prioritize and support the support surrounding that increased access to housing. Because we mentioned at the very beginning that unless people are feeling safe and well in their workplace, the services and supports they're going to be able to offer will be limited, and they won't stay in the sector. So I think that's one point. I think there's another opportunity the pandemic's taught us, is that we can get people out of street situations and unsafe shelter environments into adequate and decent quality housing if we make a concerted effort. That happened across the country. It wasn't perfect, but it showed us what can be done if we take a systems approach. How can we continue that momentum? And the third thing is, I think the pandemic's taught us about our interdependence. These aren't problems faced by other people somehow disconnected from society that's not experiencing extreme poverty and not experiencing homelessness. We're all in this together is a fundamental message that's come through in the pandemic. And I think perhaps there's some momentum there to capitalize on engaging Canada as a whole to recognize that we need to do better from a systems level for people at risk of experiencing homelessness. And in the midst of this, the folks who are working incredibly hard to support them in their recovery path.
Yeah, of course. Yeah, so I think, thank you. And for copies of the studies or to receive future updates about the research, you can contact Nick here with his email. And we move into Q&A. Here are just some discussion questions that could prompt some of the Q&A as well.
And just want to thank you for the session.